Thank you. And thank you all for sticking around and being with us this afternoon. We have some brand new cutting edge research that we're going to share with you today. And we're also going to be interactive later on in the session. So we're going to keep you all lively and awake as we wrap things up today. So one of the things that our research team is dedicated to is thinking about how we can improve communication between patients and healthcare providers so that we can improve patient outcomes in these really difficult situations, but we can also try to prevent some of the fatigue and burnout that we heard about on our last panel. And so recently we have been looking at this in the context of pregnancy after perinatal loss. This is often abbreviated in the research literature as PAL. And so we know from all of our discussions today that experiencing any sort of perinatal loss is a fundamentally life-altering event that, of course, is going to shape pregnancy that happens after that loss. So in the existing literature, we know that women have reported more anxiety and worry, uncertainty, symptoms of depression when they are pregnant subsequent to a perinatal loss. In one particular study, women used a 1 foot in, 1 foot out metaphor to describe the experience of PAL, meaning that they had 1 foot in the camp of joy and hope and optimism, and the other foot in the camp of knowing what the worst outcome could potentially be. So it's this sort of paradox that we've been thinking about all day of multiple kind of conflicting emotional experiences. So we are really interested in the role of healthcare providers in communicating with patients during PAL. We know a little bit about this from previous research that has been done. Because this is such an important event, other scholars have recommended that it's really important, of course, for providers to know a patient's complete obstetric history so that they can address previous loss. Because we know it's such a fundamentally life-altering experience. There's some research that suggests that it might be helpful for providers to encourage patients to call the clinic or even show up if they need some additional reassurance. And some research that also suggests how important it is to talk openly with patients about personal choices during their prenatal care. However, despite this small existing literature, we also know that patients continue to report not getting the compassionate care that they want and need during pregnancy after a loss. So we started by talking to patients and to healthcare providers about this experience. I'm going to talk a little bit about our ongoing work with providers, and then we'll talk a little bit about the work we've done with patients. So you're getting a preview of some brand new unpublished research here today. This is actually an ongoing study. So we have been interviewing healthcare providers. We've interviewed 18 up until this point. We're still talking to healthcare providers. So if you might be interested in talking with us, we are going to share information later today about how you could do that. We've interviewed, I think we're actually up to 20 now. We did a couple interviews after we submitted our slides. And we've interviewed a range of providers. So we've talked to OBGYNs, doulas, social workers, nurses, any provider who self-reported that they work with pregnant patients. And we found so far in our preliminary results that providers report that they recognize that a loss might impact a subsequent pregnancy. They want to offer compassionate care, but as we've heard previously today, they don't get training in how to do this. Based on what we've learned so far in these interviews, we're trying to work on specific suggestions that we can offer to providers and eventually turn into formalized training to give them the tools that they want and need. So we know that it's important that providers consider how much they might want to inquire about the patient's history. Sometimes there are gaps in the electronic medical record. For example, a record might show that losses had happened, but the provider may not know the type of loss, the extent of the experience, and so having a more complete history is important. Observing nonverbal cues. As communication scholars, we're always interested in nonverbal communication and training providers how they can pay attention to what's going on with the patient. And kind of hand in hand with that is assessing the patient's emotional state. So that can come through nonverbally. It can also be paying special attention to statements that a patient might make about being extremely worried or being nervous or being anxious, and then delivering information in a direct yet empathic manner. So I'm going to share with you a couple of quotations from providers that we have interviewed just to share some of the things that we have been seeing in our data. So the first is from an OBGYN, and the OBGYN said, I definitely talk about every pregnancy and what happens with every pregnancy. If they had medication or surgery to assist with miscarriages, if they had any genetic testing or anything related to those miscarriages. I don't usually check in emotionally necessarily unless they have some signs that they've had a hard time talking about it. But I think people who are actively pregnant, they aren't usually feeling emotions about the loss. So there's some things that this provider is doing well, and it can be very easy to criticize healthcare providers. So what we want to think about is what's going on that is positive and what is a training opportunity. So the provider does talk about discussing the history with the patient and kind of paying attention to some emotional signs, although that's a training opportunity. And I think, of course, we heard from the reaction in the room, the big training opportunity is this assumption that a subsequent pregnancy somehow erases a previous loss. And we know that that's absolutely not the case. As Dr. Berry reminded us this morning, that's a loss that lives in your body, and a subsequent pregnancy does not in any way erase that. This is a training opportunity. This is an opportunity to train healthcare providers that this is not necessarily the case, and that's why it's important to check in with patients. In contrast, we have a quotation from a doula who said, yeah, you definitely see a lot more heightened anxiety, talking about the PAL context. They can be more nervous about wanting to hear the baby's heartbeat all the time, trying to share the combination of like, yes, it's good to be able to hear that, be able to feel the baby move. We can sit, do different things where we can map where the baby is in the belly, kind of show mom like where the different things are of what she can do if she's feeling really anxious about baby not moving. So this is a really specific kind of observation about things that can be taught to a patient in noticing what's going on with her body. You can see that the doula goes into this with the assumption that the patient's probably going to be feeling anxious. So one of the things that we're thinking about as we continue to conduct interview and look at our data is doing some comparison between different types of healthcare providers. So again, if that's something you're interested in, we'd be happy to talk to you about that, and we'll share information later. But our take home so far is the importance of patient-centered care. And I'm going to turn things over to Dr. Brand, who's going to talk to you more about that from the perspective of patients that we interviewed for these studies.
Thank you, Dr. Butte. So as Dr. Butte had shared, we've talked with healthcare providers, but we also wanted to know what patients were experiencing, what their perspectives were. And so we interviewed 16 women across North America who went on to have a live birth after experiencing some type of loss. And that could have been a miscarriage, a stillbirth, an abortion, or a termination for medical reasons. And what we found from them is they have this real desire for patient-centered care, even more so in the subsequent pregnancy than they did even in their first pregnancy. And, we've been throwing around the term patient-centered care, and just so we're on the same page, that's really looking at a patient holistically. You have to look at the whole patient, not just the physical symptoms. And this is especially important in the pregnancy context, because we all know that pregnancy is more than just the physical changes in a body that leads to a birth, right? So we have to look at some of the psychological and the social challenges that a patient may be facing. So part of patient-centered care is patient-centered communication. And we argue that patient-centered communication includes 3 elements, and that's recognition, exploration, and therapeutic action. And the women in our study really gave us some specific examples of what should be included when communicating with patients in each of these elements. And so I'm going to highlight some of those things for you today. So in terms of recognition, this is, first of all, important for providers to give women space to be able to share their experiences. And then once they do that, acknowledgement is going to be key. And we're talking about acknowledging how the woman is feeling, but also just acknowledging that there was a loss. Women were very frustrated and hurt when providers didn't even acknowledge that they had a loss before and how that might then impact the subsequent pregnancy. So that acknowledgement is going to be key. And then that validation, and we've heard people talk about that today, like validating the experience that she's had and the feelings that go along with that, and letting her know that it's okay to feel however you feel. There's no one right way to feel about this pregnancy or previous pregnancies. Another part of recognition is engaging in active listening behaviors. And that's more than just hearing the patient, right? So we want to engage in active listening behaviors like making eye contact, head nods, the mm-hms, just showing that you're paying attention. And Helga had said earlier, we listen to understand, not to respond. And so showing the patient that you're paying attention is really vital. And then finally, in terms of recognition, it's important that we engage in some facilitative communicative behaviors, and this would be things like rapport building and partnership building, because you can go a long way if a woman knows that you're in this with her. Okay? The second part of this, after the recognition, is the exploration, right? So exploring what the woman is feeling, the emotions that go along with that. And one of the best ways to do this is by asking open-ended questions. Ask those open-ended questions that she feels comfortable talking about and sharing her concerns. So you want to elicit those concerns. You also want to clarify any kind of emotional response they might have. And it's also really important to find out, how does a woman want to handle the emotions that she's experiencing? Because like we said before, reproductive loss is a unique experience for each woman, and how she wants to manage how she's feeling about that's also unique. And so it's important that we go with her along that journey. And then finally, with the therapeutic action, this is when a provider is attempting to respond to some of those emotions. And one of the best ways, and actually what all of our participants had shared, is like they need reassurance. They need to be reassured that what they're experiencing is okay and how they feel about it is okay. Right? And so this is going to be really important. But beyond reassurance, providing additional information or resources is really vital. And so a lot of times women will share they have a lot more questions this time around, things like that, they didn't know to ask about before, and now they're concerned about things. So if you could take the time, and it doesn't even have to take that long. I mean, Dr. Buskmiller was great when she says, like, carve out that time, and we want you to do that. But what we found is it doesn't have to take a lot of time to actually answer the questions that women have. And then also providing additional resources. So for example, Dr. Butte had mentioned like being able to provide like additional testing or things like that. So sometimes women just want another blood test to make sure that their HCG levels are rising like they should. Sometimes they want another ultrasound, and we recognize like that has to be something that's feasible because we live in a system where that may not be feasible for some women, but it's important that you comfort them and provide that if possible. And then also providing resources by like referrals, for example, referrals to local support groups, online support groups, or therapists if we think that that might be necessary. One thing that is really key with all of these tips that we received is everything has to be done with compassion. And that's really the theme that we're hearing about, today. Like, you have to show compassion to the women that you're caring for. So I want to share with you a couple of quotes as well from hearing the women's voices of what they are experiencing and their suggestions for us. And so the first quote is actually some language that Tony had provided. So when a provider is actually inquiring about a loss, here's some things that she thinks would be helpful to say. You could say, I'm asking you this because I care about you. Right? I care about your pregnancy. This is the reason I'm asking about this. It's not to make you feel uncomfortable, but this is going to help both of us. It will help me to care for you throughout your pregnancy and for you to have all the knowledge that you need as you go throughout your pregnancy. Just something like that. So something very simple, like explaining why you're asking about that, not to re-traumatize anyone, but to know that this is how we can provide the best care for you. Okay. Similarly, Ruth provided an example, first of all, what not to say, and then how you could counter that. So there's nothing to worry about. Don't say that to anybody, right? Last time there was something to worry about. I would have liked to have heard, you know what? I totally understand you had a miscarriage. That can be really traumatic. I understand that you're here early because of concern. I'm with you in this. Right? So there's that partnership building. And we're going to do everything that we can to get a good outcome. So using that we language is really important. Okay? And then two more brief examples that really speaks to the therapeutic action. Faye, when talking about her own experience, said there was more reassurance, I think, and she did let me know that there would be more monitoring of the pregnancy, which I was grateful for. Okay? Felt like she was seen and heard. And then finally, Jane said, be able to offer resources because a lot of women don't know that there is such help for them. Not only are they meeting me and my crisis, but they're also getting me the resources that I need to help better get through the process. So really, showing compassion to these patients and doing this through recognizing their experience, exploring their concerns, and then providing some of that therapeutic action. So now that we briefly highlighted some of the research that we have done, we want to share with you a technique to help you observe and practice some of these strategies. So I'm going to invite Dr. Binion up to talk about forum theater.
Great. Thank you, Dr. Brand. All right, here comes some interactivity. Are you guys ready? Okay, so forum theater, very different than what we've been talking about today. And you're probably like, why are we talking about forum theater? Well, it's a really interactive, engaging, and very effective improvisational educational technique. And so it was created by Augusto Boal in the 1970s. He was influenced by a Brazilian educator, Paulo Freire, who is like I said, he's an educator, and he was really passionate about the idea that we create knowledge and we learn from one another, the co-creation of knowledge. And so he has this idea, a pedagogy of the oppressed. It is a whole field. It is an approach to teaching and learning. And so Bao was not only was he a theater practitioner, but he also was a political activist. And he was really passionate about using theater techniques to help drive social change and advocacy work. And so he calls his work the theater of the oppressed. And so again, this idea of advocacy, social change, making a difference. And so he was using theater to do so. And so so then in the 1970s, as he was working through this, he started to think about, okay, so how are we going to educate one another? What are the techniques to do so? And one of them is called forum theater in the theater of the oppressed. It is one technique, there's many other ones. And so the forum theater is this concept where you all are actors. You're spectators, but you're also actors. Again, it's this participatory engagement of learning. And so what happens is we will stage a scenario, and as actors, you watch the scenario, and we will reset the scene, and you'll be able to engage and step in and change the dynamic, change the dialogue. So it helps you start to see the different ways that you can take different conversations. This has been happening in different types of spaces. Folks use this for climate change, for some social other advocacy work. So you're probably like, why are we talking about that in the reproductive health space or even healthcare in general? Well, we're all as healthcare professionals are confronted by difficult conversations and difficult issues. And so one of this technique is really helpful in building your confidence, building awareness. For some, awareness is not present. Maybe they didn't receive any education. And so this theater and this engagement activity is really, really helpful for them to step in and think about, how would I respond or how would I interact with somebody? And so forum theater can be engaged in workshops, grand rounds in healthcare professions settings, even in just a classroom. It doesn't need to take very long, and we'll kind of do that activity today. And healthcare professionals have used this too to combat biases, teach residents how to be more inclusive in their environments. And so it's really effective in different modalities. And one of the ways that has been really effective is engaging them in enhanced empathy, really improving their communication skills, because as theater, if we ever go to a theater in the stage, they're communicating with us. They're sharing something, unless they're going to a silent movie or something. Self-awareness of bias, collaborative problem solving. So again, you'll have the opportunity to think about, how would I change something? What would I do if I was in that seat? So again, a little bit of watching somebody else, learning from others, but also learning from yourself. But again, co-creation of knowledge, and then increased confidence. If we've ever had to go into a patient's room and break that news for the first time, it might feel a little bit overwhelming. But if you were put into a scenario in which you weren't talking to the exact patient, but were able to practice, you might feel a little bit more confident before going and actually seeing a patient. So this is your activity, all right? So what we are going to do is, you're going to be watching a scenario. Dr. Butte and I will be kind of performing the scenario. It is short. Afterwards, we will debrief kind of, what did you see in this situation? What did you like? What did you not like between the patient and the provider, their communication? Then we will restart the scene. If you want to start or stop the scene, you will raise your hand and say stop. That is when you want to jump into the scene and start changing the conversation. So you become the actor. And whoever you change, you can replace me as the patient, or you can replace Dr. Butte as the healthcare provider, and we'll start that conversation right where you stopped it. And so you'll start to see, we'll reset the scene a couple of times, so you can start to see how this conversation, even though it's the same scenario, it can go in a lot of different ways. If you're thinking, oh my goodness, what would I say? I know for the in-person attendees, there was a compassionate healthcare or compassionate communication handout that you were given. So those have some really great tips in addition to kind of what we've already shared in this session and also in today. And so again, we're going to restart this scene multiple times, and we would love for you to participate and step in as needed. And so without further ado, we will start.
So to get us ready, can I get everybody here to stand up? So we're going to stretch a little bit so that way you're not uncomfortable getting up and down. And for those of you in Zoom, I encourage you, stand up and stretch too. I know we're towards the end of the day. If you are on Zoom, in the Zoom chat, when you see the scenario playing out, I know that you can't jump into this space quite literally, but I would love for you to type out something that you see that you would want to change up and how you might want to change it up, okay? All right, everybody stretching? Good, right? It's good. Yes, I love it. I love it. Okay. All right, we're going to play through the scenario one whole time. Okay, so watch the scenario, pay attention, anything you think that's done well, things that you were like, oh, I think I might want to change that, because then we will start again, and that's when you will have the opportunity to start and stop. Okay. All right, so let me set the stage for you for a little bit. So give you a little bit of background in the scenario, okay? This is the first time that Naomi has been in the clinic since her miscarriage 5 months ago. The clinic smell, the hospital gown, the doors opening and closing, and the muffled sounds of medical assistants in the background are giving Naomi uncomfortable memories. She tries to stay calm by taking deep breaths. Finally, after waiting 20 minutes in the room alone, Dr. Klein knocks on the door and enters the room.
Hi, Dr. Klein. It's good to see you.
You too. You're here for your first prenatal appointment.
Yes, that's correct. I made an appointment right away because I had a positive pregnancy test last week, and I was really nervous. So I made an appointment right away because of, my miscarriage a few months ago.
Well, you're young and healthy, so I'm not worried. Miscarriages are very common. Each pregnancy has about a 10 or 20% chance of ending in a miscarriage. And like I said, I don't think we need to be concerned yet.
I mean, I understand that miscarriages are common, but is there like anything I should be doing differently?
No. Again, miscarriages are very common, and there's really nothing we can do to prevent them. It's important that we focus on the present and not the past. So let's talk about what medications you're taking.
Let us play it through one time.
Good. I love it though.
Yes, I love it. Hold that thought. Hold that thought.
I love that. We are definitely coming back to you.
We're almost done.
No, you're good.
You were paying attention, and I love that. Okay. Good. You saw it.
But I can't help but feel scared. I mean, again, I was really hoping that we could talk about the ways that we can make this pregnancy as safe as possible.
I understand that you're scared, but there really is not anything to be scared about. Miscarriages happen. They're not something we can control, so let's just focus on the present. So what medications are you taking?
Okay.
Let's just go through everything together. We'll talk about your daily habits. We'll talk about any risk factors that you might have.
But like literally nothing has changed since my miscarriage.
Okay, well, we'll still review your medications and go over everything together.
Okay.
And scene. That's right. Okay. All right, so obviously some things that probably were done well, some things that maybe weren't because we already wanted to stop this. So just throw out a couple of things that you noticed about the scenario. Okay, so being in a room by itself, so from the very beginning, okay? Something else. Oh, lots of stuff happening here. Okay, say this again up front.
Yeah.
Yeah. They were not attuned. Yes, exactly. Someone up here said say something. No eye contact, not looking at her, okay? Didn't know her name. Okay. And how did you know the doctor wasn't ready for the patient? Okay. Look at the notes. Yeah. Okay. So there's a lot of things going on. So we're going to restart this again. You've given us several different things that we could potentially change because there's a lot of different ways that this could play out. And so getting excited, everyone's ready. We've been up and down and moving. We're going to start the scenario again. At any point in time, if you want to stop the scene, yell stop, raise your hand, and then we will invite you into the scene and you can say who you want to replace and we'll go with that. And then we're going to keep doing that. So like we don't play through the whole scene. You jump in each time that you want to change something. And we're all learning with each other. Like I said, there's lots of different ways you can do this. So just because someone else comes down, you replace them too. You don't have to just keep replacing Drs. Benden and Butte. Okay? All right. So here we go. And
Hi, Dr. Klein. It's good to see you today.
You too. I see that you're.
all right. Who said that? Here, okay. So come.
Yes.
This is so good. This is so good.
You got this.
So who would you like to replace? Oh, you're definitely.
Yeah.
Okay. Oh, thank you. Okay. Okay, make sure that you speak into the mic.
Yes.
Come down here. Speak into the mic. Okay. All right, go ahead.
Hi, Naomi. It's great to see you too. How have you been?
I've just been really anxious and nervous this past couple weeks.
Absolutely understandable. And I'm so glad that you're here so that we can talk over what's going on for you now and how we can best support you. So I do see that you had a positive pregnancy test and you made an appointment.
Yes, because, I had a miscarriage, a couple months ago. And again, I want to make sure I'm doing everything right.
Absolutely. And it's so hard because you are doing everything right. I'm so glad that you came in, and it sounds like you have some things you want to ask. So we have confirmed the pregnancy test. Go ahead and ask some questions.
So I think, what should I be doing like right now? Like, is there anything, I've been nervous, I've been anxious. Is there anything to like alleviate those feelings?
That's a great question. I think different people do different things to attend to their anxiety, and your anxiety is perfectly normal based on what you went through. What are your thoughts about engaging in some deep breathing just to even relax you right now?
You know? Okay.
It's like, I'm assuming you want.
Yeah.
All right, Naomi. So, of course, I have questions for you, but we're going to put those aside just for a second. And you shared a little bit about your anxiety.
Mhm.
Are there any specific thoughts of fears that are coming to you?
Yes, I just keep going back and thinking about, what the feelings were like, how scared I actually had a healthcare provider who wasn't really kind and made me feel really alone. And I'm just afraid that I'm going to be put in that spot again.
Yeah. And at any moment, please make sure that you have a voice. You can advocate. If I will make sure and do my best to always be here for you in every capacity that I can. And all of our staff here, if you ever have questions, concerns, is normal to have. Normal to have them, normal to have those fears. We would love to answer it as much as we can.
Right. And do I just like call the office, or like every time I call, like sometimes I get someone on the line, sometimes they call me back, and then I don't get a call back? Like, what do I do?
Well, with our office, the easiest form of communication would be through my chart. So electronically sending that message, usually within 24 to 48 hours, we'll give you a response.
Okay. That makes me feel really reassured. Thank you.
Thank you. Well, you can tell that some people have been trained by the Institute because they're
Feel
doing
very
some great
reassured.
things, but let's see, like what did you know? So I also, I'm sorry, in the chat when we were talking about the first time, someone had commented that this was invalidating the patient's feelings, the very first scenario, and so we were trying to not do that this time. So, what were your reactions to that scenario? Better. What was better about it? Okay, so okay. Okay, so you think there should be some more inquiries, more exploration of like the miscarriage, what kind of support. So we're going to do it again. I might might want you to jump on in here. That okay. One more comment. One more thing that you noticed. Yes. Okay.
That's something that I
Mm, yeah. Okay, thank you. And so what she was saying is like it's really important to, you know, assess like suicidal ideation. So we want to make sure like where is this patient right now in terms of grief and depression and trauma and suicide thoughts and things like that. And so that'd be important. Okay, we have time to run through it one more time. You don't have to let it go as long if you want. Jump right in. Like I said, it's all learning experience. We want to see all these different directions it can go. But thank you for our volunteers. You both did a fabulous job. And so we're going to turn it over one more time.
Hi, Dr. Klein. It's so good to see you today.
You too. So it looks like you're here for your first prenatal.
Yes, that's correct. I had a positive pregnancy test last week, and I made an appointment right away because of my miscarriage. A few months ago.
Well, you're young, healthy. I'm not worried. Miscarriages are very common.
Come on up here. Come on up here. Are you wanting her, the doctor? I just make sure you talk in the microphone.
I'm going to need to.
I'll say, my miscarriage a few months ago.
Yes, I'm so sorry to hear about that. Before we actually dive into this appointment, can we just take a little bit of time, if you're okay, with talking about that experience that you had with your miscarriage?
Yeah. So, when I had my miscarriage, I actually was alone. And I didn't have my partner with me. And it was really traumatizing because I was looking up information online. I was too scared to, go to the ER, seek medical attention. It was my first pregnancy, and I really didn't know what to do. And I eventually went to the, doctor, and I was met with, it was really unkind, and just didn't see me like it was like a real experience.
So first off, let me say that I'm sorry you had that experience. And that had to be very traumatic, like you mentioned before. So can you tell me a little bit about the support that you might have received after you got that information? I'm loving this.
Do you want to just repeat the question?
So, if you don't mind, could you tell me a little bit about the support that you received after receiving that information?
Support? Really? You're gonna ask about support? I got no support.
Okay. So, I'm very sorry that you didn't have any support. So, what would you feel would have been helpful for you through this experience?
I got nothing.
Okay.
Nothing.
So, did you, and now I'm just going to inquire a little bit if you don't mind. So, did a provider, did they follow up with you? Did they call? Did anyone ask how you were doing? I know you said your partner was not available at the time when you got this information. So just nothing.
Nothing. Nobody
Okay.
cares.
Okay. Come on.
You're good. That's a good thing.
Yeah.
Make sure you speak into the microphone.
It
No.
sounds like you have gone through a lot.
Yeah. I
Do you
have.
mind sharing a little bit about your experience? This is a safe space. You can tell me anything. Nobody's going to judge you here.
It feels like somebody wants to talk now, but nobody wanted to talk then.
Probably was
So why should I talk now?
Because I can see that hole in your heart. Still grieving and probably feels very lonely. You've been carrying this pain for a long time, haven't you? Tell me more.
Thank you. Thank you so much. Thank you. Do you need another tissue?
Yes, the whole box
Okay,
probably.
take the whole box. Take the whole box. I've got multiple microphones. Can someone take a microphone? Someone take a microphone. Okay. So thank you for our volunteers doing that. One thing that Kelsey's going to debrief the whole thing, but one thing I wanted just to point out that I noticed is notice the silence. And so often we're scared of silence. We feel like we have to fill that, but so often that's what a patient needs. And so that's something else to remember as well. Okay.
Okay, thank you. And so again, you can start to see how the changing of the actors or different perspectives shifted the scenarios, and that is the concept of forum theater. And so we could be here all afternoon and be resetting the same scene over and over again. And so this is kind of just some insight into how you could integrate this as an educational training material, and you start to engage with others, you learn other people's, it becomes a really safe space to provide constructive criticism. And it's different than, sitting down and reading a case study and saying, okay, how did you feel about that? It's actually putting you in the position and practicing, again, building those empathy and understanding and confidence skills. So thanks again to those who came up today. So we just